Welcome back to Dealing with HIV/AIDS in your new venture. Today we're going to be looking at the third module, which is safe and risk behaviour related to HIV transmission. And here are the module outcomes that we're going to be looking at today, which is firstly, outlining the relationship between human behaviour and the HIV/AIDS at a basic level of understanding. Name the ways in which the individual can avoid contracting or spreading HIV/AIDS with an indication of their own behaviour, which can reduce the risk of infection. Name examples of behaviour that can carry a risk of contracting HIV/AIDS and classify it according to whether they carry high, medium or low risks. Let's have a look at knowing what behaviour is safe and what behaviour carries the risk of HIV transmission. AIDS is not a disease of gay men or drug users. It can happen to anyone who indulges in risk behaviour. Having sex with a virgin does not cure AIDS. Everyone and anyone can get HIV/AIDS, but those most at risk are your youth, women, migrant workers, long-haul truck drivers, and sex workers. The relationship between human behaviour and HIV/AIDS. HIV can be spread by having unprotected sexual contact with an HIV-positive person. Unprotected means sex, anal, oral, or vaginal, without barrier protection like a condom. Some of the ways to reduce your risk of getting HIV through sexual contact includes not having sex at all. Anal, oral, or vaginal is the main way that HIV is transmitted. If you aren't having sexual contact, you are 100% protected from getting HIV in that way. Be monogamous. Be monogamous means you are in a sexual relationship with only one person. Both of you are having sex only with each other. Ways in which individual can avoid contracting or spreading of HIV/AIDS. Get tested and know your partner's status. Knowing your own status is important for both your health and the health of your partner. Talking about your HIV status can be difficult or uncomfortable, but it's important to start the discussion before you have sex. Use condoms consistently and correctly. To reduce your risk of getting HIV or other STIs, you must use a new condom with every act of anal, oral, or vaginal sex. Please refer to pages 39 to 42 in your learner guide on how to use condoms. Examples of behaviours that carry a risk of contacting HIV/AIDS. Very low risks: kissing, if no blood is exchanged through cuts or sores; touching, such as stroking, hugging, or massage; masturbation, which includes mutual masturbation; oral sex on a man with a condom; oral sex on a woman with a barrier method, such as a plastic wrap, dental dam, or a condom cut open. Other low risks would be wet, deep kissing with sores or gums disease and therefore blood are present; oral sex, vaginal sex with a male or female condom, or anal sex with a male or female condom. High risk would be anal intercourse without a condom and vaginal sex without a condom. Situations that have potential to spread HIV/AIDS in the workplace. There is no known risk of contracting HIV from working in a normal group setting. The best policy is to treat all workplace incidents as if there is a HIV risk. The only jobs which might put you at high risk are those where you have to work with people's body fluids, such as a medical technician, a nurse, doctor, or even a tattoo artist. Fears and common misunderstandings about the transmission of HIV/AIDS. A person cannot be infected through sharing the following: toilets, showers, mosquitoes, tears, shaking hands, hugging, kissing, sneezing, coughing. Behaviours and activities that carry low risk of infection. Although tears, urine, and saliva may contain low concentrations of HIV, transmission through these fluids is extremely rare. No case of HIV transmission has been traced to the coughing or sneezing of an infected person or to a mosquito bite. A person who does not engage in sexual intercourse and does not inject drugs, or who uses clean, sterile needles or syringes for such injections, have almost no chance of contracting HIV or STDs. The role of sexually transmitted diseases in the transmission of HIV virus. It has been well documented since the early 1990s that people who are infected with an STD, such as gonorrhea, syphilis, or herpes, are much more likely to acquire an HIV infection. If an HIV-infected person has an STD as well, the risk of infecting another person goes up dramatically. Please complete class activity 3 in your workbook. Thank you.